I've worked in lots of diverse areas where the culture and language definitely influenced how we interacted with patients. And in my early days, there was a time where we employed strategies that weren't as successful. And we could have known that or been better positioned to have better strategies that would have appealed to those populations had we known, right, the population that we were working with and just some of the nuances, if you will. The other thing that struck me was about health literacy and why I think that's important. So part of my background before getting into healthcare was working in education and working with adults, but also working with children. And I actually did a project with a underserved population in Southern California, one of the poorest school districts actually in the United States. And it was looking at strategies with fourth grade language acquisition students. But the thing I think that was important that folks maybe don't realize is that if you have not acquired that second language by the time you are about 10 years old, the likelihood of you ever reaching a point of mastery is really, really rare. And I think that's important because we assume when people are speaking or can speak the language that they have that mastery, right, over the language. But what we fail to recognize is the inner workings of the brain. And so uh, the brain typically will then translate right in the native language, and it can create barriers. And so I think that nothing is more important. In fact, we know one of the biggest predictors of health outcomes is health literacy and education level. And I think that this is a really important focus for CMS, and definitely agree, that it was identified. And I think that tools that can help us sooner identify populations where, there should be a respective culture, right? There should always be a respective culture, but where you can better accommodate what you're doing to suit that population, the better. And I can think of working in places like Northern California and particular cultural groups that didn't want people to come into their house or even told us that phone calls, that they were hesitant to pick up any phone call because they were concerned and didn't trust anyone calling over the phone. And so unless you were speaking in the native tongue and they knew, who translators were and such, but unless you had the particular dialect, that they typically didn't respond to those calls. And so I think that there's opportunities to leverage that information and to use that to better assist patients, not only from a standpoint, right, because it's about health literacy and taking up health. So not only from a standpoint of getting folks involved and in their own healthcare and educating them, right? But it's about educating them through the process as well. And so working with them on why it's important to get vaccinations, why it's important to get routine physicals, why it's important to adopt a particular diet, why it's important to quit smoking. All of these things are important. And I think that when you bring that respect of culture and of language, that it's very important.
You formally. So thank you, Dr. Decker. Could you please let me know how you feel about access to language services, inclusive languages? What do you think where we are today, and where you think we have made progress and where we find challenges today in US?
I think we've made some progress. So I would say that we're not where we were 10 years ago, but we're definitely not where we need to be. I think some of the things that I've noticed regard to progress is even running programs throughout the United States and being mindful of the population and what would appeal to them. And so in certain areas, and I can just share in working with particular medical groups in certain areas, providing home visits as well as clinic visits, providing health fairs that might be more advantageous, or using telehealth. So those are all different ways, especially if you have particular groups that don't want you in the home or would prefer, right, a more social situation or more social setting, I think is important. But when it comes to language, I think that there's still opportunities. And so I do look for groups where there are native speakers among, say, if I'm doing home visits, I'm looking for native speakers among the nurse practitioners that I might be using to do assessments. I used to do health fairs in Northern California, and we were lucky enough to have a couple of nurse practitioners that were native Korean speakers. This was really important because they could explain what was going on in the native language, and it was building a level of trust that we wouldn't have been able to do had we not had that nurse practitioner. We did the same thing when we did our outreach line to either call on any of our quality measures to try to close those gaps, or in trying to schedule patients for their annual wellness exams. And so I think that that's really important. I think that there's a lot of groups that are using services, and those services aren't bad, but I would say make sure that if you've done the good work to get the data and you know who your population is, when you're looking for translation services, so say you're using a larger outfit or trying to build a scale, do look and do listen in. We did find that there were instances where those that were translating, when we did use particular services, were not as skilled, or maybe not presenting information in a way that we would have liked. And so I think it's really important to stay in touch. Same thing with translating materials. A lot of times materials are translated, and I think a lot of the larger companies have learned their lessons over the years where they've done mass translation and they're translating word for word. Well, we know, right, that that's not the way in which the semantics that someone would use in that native language. And so making sure that you're having a native speaker review the materials, review your call center to ensure that you're meeting your patients where they're at. I think there's also something to be said, though, too, about how you're engaging. And a lot of the times, the things that we think, in corporate America are important and salient points to convince someone to say, go get their vaccinations or make sure that they're monitoring their blood sugar. That the same reasons that we personally feel appeal to us may not appeal to another population. And so having that recognition. I know that there's a lot of groups out there recently, even around the Food as Medicine program, which I love. And they've taken a step further to pay attention to and be culturally aware. So how do you speak with a family that has certain cultural foods that are important to their diet? How do you respect that? And still honor their way of eating so that they can continue. Because to ask someone to get rid of a particular staple in their diet just to meet, a diet that we're recommending, that doesn't have to be. There's ways to work around it. And I know that there's a lot of really great programs out there that are doing that type of work. So I think we have access to the data. We need to continue to get better data so that we're more informed as far as who our patients are. And then I think that there are ways in which we can be more reflective of not ourselves, right, but more of reflective of how we're interacting with others, but appreciative of the diversity that others bring and how it's different than ours. And just because it's different doesn't mean that that it's not the way one should be, right? I think that there are ways to appreciate and honor and respect other cultures.
That makes a lot of sense. And those of us who can speak in two languages, I'll encourage them to think of ways to express them. It's very difficult to translate from one to the other. My dear friend, she's explaining to me a symptom and she say, "Mera sar khali hai," which translates to "my head is empty." But that's not what she means at all. She means that she is finding a hard time focusing herself. So the exact translation sometimes doesn't even work. And even you're so right that the cultural sensitivity is very critical and goes beyond just the literal meaning or translation of what they're trying to say. And it's very critical for the patient to feel safe that the care provider, the physician or the nurse understands their culture also, the context, the food. The food as medicine is entrenched in the South Asian thinking where I come from. So we try, the first line of defense is always food. Like if you have a tummy ache, drink aniseed water. If you're having a headache, have tea with spice in it. So there's a cure for everything, which I think everybody in our culture knows. And I see this thinking now coming to the West, and I think it's a good movement. But some of these things are really entrenched in the culture, and I think the physicians and the nurses, if they know that thinking, it helps them to treat the patient. And when I'm looking for a physician for my mother-in-law who lives with us, I always go with somebody who has the similar background, because then she can communicate about her diet, the impact of that diet, how she's using food as medicine, what's the outcome of that. That's her first line of defense. And I think that'd be very difficult for somebody who is not so well versed in our culture. It doesn't have to be the person with a grown up in that culture, but somebody who has taken time to become well versed with that, and they understand that culture. And there are folks who can learn it, like we have learned the American culture, I hope. So I think this mutual teaching has to go on.
Absolutely agree. Absolutely agree. And I think, your comment about understanding the culture and that there might be other ways, right, of practicing medicine. I think that those ways are very beneficial. And I think that it's time that we respect and understand, the different ways in which we approach healing. And I think that's very important. I lived, in the United States and was born American. But just to share a personal story too, my grandmother grew up in Appalachia. And so the ways in which they did things and using roots and things from the earth,
Mm.
very beneficial. But again, I think it's other perspectives, and that's not to say that they aren't, valuable. They absolutely are. And to your point about trust, I think is very important too, because who's going to want to apply a remedy that they don't necessarily trust, or is foreign to them, or may make them sick first
Mm.
before they get well. And so I think that there are other ways to approach things. I love that contribution. Thank you.
Thank you. Thank you for joining us, Dr. Decker.